With it being winter, many of us might think we can, ease up on the skincare and the sun protection for sure. But the truth is, taking care of your skin is something that you need to do year round. So today we're talking with Dr. Karina Paci with Cone Health Dermatology about how to keep our skin healthy through the seasons, including the cold winter days. Okay, a lot of folks just stop using sunscreen when it's cooler. They're not thinking this is beach weather or pool weather.
Yes, well, it's a pleasure to be here. Thank you for having me. To answer your question, sun protection should be used all year round. Whether it's in the winter or the summer, those UV rays are hitting your face, they're hitting your sun-exposed skin. So you need to be protected daily. So we recommend a daily sunscreen with SPF 30 or more on your face at least once a day as part of your normal morning routine, especially if you're just going to be out and about running errands, going to and from the car, to the doctor's office, to the grocery store, things like that.
Yeah, people don't think they need sunscreen for that, but they need sunscreen on the everyday.
Right.
Okay, so what are some other maybe common skincare mistakes that people make during the colder months?
So I would say kind of not moisturizing enough. Moisturizing is good all year round. Depending on your skin type, you may need it more often than others, meaning more times throughout the day, but kind of not staying consistent with our moisturizing regimens. Again, we talked about not protecting against the sun. So those UV rays are present all year round. You can even check the UV index on the Weather Channel and your weather app. It'll tell you, but even if it's a cloudy day, you need to be putting on that sunscreen. SPF 30 or more protects around about 97% of UV rays. And then I found a lot of recent trends include adding products that are considered natural, meaning they have a lot of plant-based products. Those are all extra additives that can cause contact dermatitis or allergic reactions on the skin. So really keeping your skincare regimen very, very basic and knowing what's in your products.
Okay, we're going to dive into that a little bit more as we go through. Should we have different skincare routines in the winter versus the summer?
That really is going to depend on your personal kind of lifestyle and your personal skin type. So in general, patients tend to identify as either dry or oily skin. Those who have drier skin tend to become even drier in the winter. And so they'll probably need to increase their moisturizing regimen or even carry, something like some cream in their purse or in their kind of like car just to have on hand as they get drier throughout the winter season. And for those who have oily skin, they tend to feel a little drier, but it might be kind of like a good neutral in the winter. Winter tends to be a time that some chronic skin conditions can flare, like eczema or psoriasis. So one of those reasons those happen is because the skin barrier tends to break down a little more easily in the winter months. So again, trying to keep that moisturized, keep that skin barrier intact with your moisturizers, which the best version of moisturizers are going to be ointments or creams. So those are going to be better than lotions because they are better at trapping that moisture in. So in general, again, if you're someone that's going to be outside a lot in the summer, but maybe not as much in the winter, it's still going to be recommended for you to wear that daily SPF 30 on your face. And maybe you don't need to lather up the rest of your body, but you're still exposing your face every day, going in and out of your house, living your day-to-day life.
Okay, so I mean, you made it very clear, regardless of the season, we need to be aware of the possible signs of skin cancer and, keeping it away. So what should we be on the lookout for when it comes to signs of skin cancer?
Yeah, so there's two main categories of skin cancers. The non-melanoma skin cancers, those are actually more common, tend to be caused by cumulative sun exposure. Those are going to be your basal cells and squamous cells. In general, those are going to come across as a non-healing pimple-like lesion, usually pink or red, can have some scale, can bleed, can be painful, and it just doesn't go away. If it's a skin cancer, it's not going to go away on its own. And then the other category that some people might have heard of, the ABCDs of melanoma, those are skin cancers of pigment-producing cells in our skin. The traditional thought is you're going to think of like a dark brown or black lesion that's kind of growing, but they can also be pink. So anything that's new or changing that you haven't noticed on your skin for a while and is bringing you some symptoms that are a little unusual should be checked out.
Okay, and is it any different for people, like the signs, any different for people with a darker skin tone?
Not usually. The lesions may present in a slightly different tone of color, but in general, those same signs of something new, not healing, with some pain or itching, or scaling, all of those are going to be pretty consistent across all skin types.
All right, and if there's something that's a little bit off, we need to go to the dermatologist.
That's right. You should see your board certified dermatologist as soon as possible.
Okay, and so I know that early detection of skin cancer, it's crucial if someone is diagnosed with skin cancer. What treatment options are available? I think people, get so scared about thinking about that then they don't go to the doctor, but let's just talk about it.
That's right. So it's going to depend kind of on what type of skin cancer you have. In general, the majority of skin cancers are going to be treated with some sort of surgical procedure. Now, there are some other ways to treat very superficial skin cancers with certain prescription creams, but those are the exception to the rule. In general, the standard of care from the American Board of Dermatology is going to be some sort of surgical procedure. And most of the time, if it's something that in an area that needs some cosmetic concerns, like we don't want to take extra skin, that's going to require Mohs surgery.
Mohs, what is that?
Mohs surgery, so it's not an acronym. Many people confuse it for an acronym. It's named after Frederick Mohs, Dr. Frederick Mohs, who came up with the procedure 100 years ago. It's an in-office procedure done here in the outpatient setting where we bring the patient in, we numb up the area that was biopsied with local injectable numbing, so they do not need to be put to sleep. And then we take a specific approach, surgical approach, to take a layer around the skin cancer, trying to keep as much normal skin on the patient. And we process that specimen in our lab here. We have amazing histotechs at Cone Dermatology, and they process the specimen, and the Mohs surgeon is also the pathologist. And so they read those slides under the microscope. Sometimes it takes anywhere from 30 minutes to an hour for those slides to process. So patients usually relax. If they come here, we offer them snacks or drinks. They can come to and from the waiting room, the bathroom. And then once we have information, whether the skin cancer has been totally cleared or if there are special roots kind of left behind, we'll let them know if we need to take more skin or if we're ready to stitch them up.
So let's talk about some year-round skin recommendations that may get overlooked.
So I'm going to sound like a broken record, but it's going to be moisturizing throughout the year. Again, the best time to moisturize is actually going to be after your shower or your bath. You should pat dry and then use ointment or a cream. I have a couple of examples here. So this is a good cream. It comes in a thick container where you can squeeze it out. And then ointments like Aquaphor or Vaseline, those are going to be thick and greasy. They actually help trap the moisture that you got from your shower and help keep that in your skin. So that's a great way to moisturize, doing that all year round. And then again, it's going to be your SPF 30 or more daily on your face, your hands, your neck, your sun exposed areas. And then thinking about wearing wide brimmed hats, those help kind of protect the sun from hitting those parts of your body that you might not realize are getting daily sun exposure. And there are a lot of different brands and different concoctions out there that are at all price points, including really good, relatively affordable options on Amazon.
Okay. When it comes to like the winter time, I know everybody's hands get like all dry and cracked, and because that's where we're working outside and we don't put our gloves on and all that kind of jazz. So what steps can we take to help prevent that and treat that?
Yeah, so the best thing to do is trying to get ahead of it before it gets to that point. So if you think you're prone to those changes in the winter, you may actually have a mild form of hand eczema. Those changes are consistent with what you're describing there. So again, you're going to want a really good emollient, meaning ointment or cream, probably wanting to carry that around with you in your car, in your purse, and moisturizing basically anytime you're stripping your skin barrier. So if you're washing your hands, if you're using hand sanitizer, if you're eating, things like that, you want to reapply. And then if it's still consistently bothersome, despite really good efforts to do that daily, then it might be time to go see your board certified dermatologist, and they may need to give you some prescriptions to help you get kind of past that point.
All right, let's talk about any kind of acne or pimples or things of that nature. People always want to squeeze them, and they think that that's going to make them go away. What do you say?
Yes, I think it's human nature. I try not to do it myself. In general, picking at your lesions, no matter what they are, is much more likely to lead to permanent scarring. So even though that's in our nature and we feel really strongly we just want to get rid of it, more than likely you're going to leave a permanent mark there. So if it's an acne bump, you may just need to let time go by. If it is like a lipoma or something more chronic or a cyst, then you should come see your board certified dermatologist. And if it's something that's bothersome to you, then it may be time to discuss getting that removed in our office.
Okay, so don't squeeze it, let it go. Is it okay to put like the acne cream on it?
Yes, yes.
Okay.
There are a lot of good products like hydrocolloid dressings. There's a lot of good products out there for acne bumps that are active and probably likely going to go away. But if it's those chronic lesions that have been there for, say, years and you're just frustrated and you want it to go away, it's much better to come in before it gets scarred down so we can take care of it in a much, much better cosmetic way than once it has scar tissue associated with it.
Okay, what skincare myth do you frequently encounter that you would like to set straight before we go?
I think one big thing is the misconception that getting a base tan means you're off the hook for the rest of the time, especially in the summers. The base tan you're getting is your skin trying to actively, quickly protect itself from the intense sun exposure that you're giving it, but that does not mean that the cumulative UV damage does not continue throughout that summer. So base tans are a myth. You are still getting the same amount of sun damage. It may seem cosmetically pleasing in the moment, but they're a great sunless tanning options nowadays that give you that same glowing look without all the damage.
The base tan is a myth.
That's right.
Okay, don't do that before you go away for spring break. All right, we appreciate your time and your expertise. If you missed any of this, maybe you need to send it to someone who's asked some kind of question like this before. It's going to be in the To Your Well-Being section of our website.